Welcome back to the show, Dr. David Klein, and today we're going to talk about, and to those of you that have hand pain. Doc, it hurts. My hands hurt. I don't know why they hurt. What's going on?
Well, you're using them too much. That's the problem. You speak with your hands.
That's what they're for.
That's what they're for. No, the problem here is that you use your hands for lots of different things. You use them as tools. You use them for expression. You use them for rest, support. You use them for comfort. Okay, the long and short of it is, hands will begin to degenerate, things will start to go wrong, things will become damaged, and you will, in fact, experience pain. But it's not lost. All is not lost. Okay, look at your hands. Okay, do your hands hurt with motion? Do they hurt with cold? Do they hurt with rest? Do they turn purple when the weather turns cold? All of these things are, in fact, clues as to what might be going on. Well, for starters, as you get older, the most common of all complaints in the hands are going to be arthritic. Okay, you take a look at your fingers, you see the little swellings along the fingers. When you have the swollen joints distally, that's the joints adjacent to the nails. Okay, these are called Haberden's nodes. Now, Haberden's nodes is a hallmark of osteoarthritis. You earned this. Okay, if you used your hands to earn a living, if you used your hands for hard work, even for housework, you're going to damage these joints. They're going to swell a little bit. Okay, it is something you can do. It is something you can treat. It is something with which we can deal. How do you deal with this? Oral anti-inflammatories, but more importantly, topical anti-inflammatories get directly into the joints of the hand quickly, very cost-effectively, and give you relief nearly immediately without systemic side effects. Rheumatoid arthritis tends to cause swelling of the knuckles. It tends to cause what's called an ulnar deviation of the fingers. They tend to drift towards the non-thumb side of your hand, away from you. Okay, when you see this, rheumatoid arthritis and rheumatoid arthritic changes are also very, very common. It might be 6-7% of the population. Again, as you get older, you'll see this. And again, all is not lost. The same anti-arthritic medications are useful, both oral as well as topical, and we tend to forget the topical anti-inflammatories. Well, past the arthritis, past the typical problems that everybody thinks that they know about, what else can cause hand pain that's easily treated, that needs to be taken care of? Otherwise, it can become more and more incapacitating. There's a tendonitis of the thumb called de Quervain's Tenosynovitis. Okay, de Quervain's is very, very common. You see this in the office 2-3 times a week. People come in thinking they have carpal tunnel syndrome because their thumb and first finger, their index finger, hurt. Well, you have pain on opening a doorknob. You have pain opening a bottle, a pain opening a can. Let's say a can of spaghetti sauce, for crying out loud. These are the hallmarks of de Quervain's Tenosynovitis. The problem is actually along what's called the radial side of the thumb. There are 2 tendons there that form what's called the anatomic snuff box. And it's very, very common to develop arthritis along this joint, the MP joint of the thumb, but the tendon overlapping it, overlying this, can become frayed, resulting in tenosynovitis called de Quervain's. De Quervain's will cause incapacitating pain. People are running around wearing these splints, so on and so forth, wondering what to do. And again, topical medications, in particular topical Pensade, Voltaren, or my Kinky's lotion, knocks that thing out in about 30 to 60 seconds. Need not worry, really? But you have to make the diagnosis. It's very, very interesting. All you have to do is take your thumb, kind of pull it down as if you're making the wrong type of fist, the one you were told not to do when you were a child. Okay, and that straightens this tendon out. It hurts like the dickens, and you, too, have just made the diagnosis of de Quervain's. Well, what else do we look at for hand pain? Well, everybody has heard of carpal tunnel syndrome. Okay, what is this? The carpal tunnel is a ligament that overlies the carpal bones in the wrist. There are a bunch of tendons that pass deep to here and one big nerve called the median nerve. Well, when the median nerve begins to swell a little bit against a hole, against an ostium, against a canal that doesn't swell, it pinches itself. When does this occur? Hypothyroidism. Pregnancy will do it. When you retain too much fluid, this can happen. Following radiation therapy, anything where the nerve itself swells against an enclosed box, okay, it will pinch itself. Is this, in fact, necessarily something you have to operate on? The answer is no. There are many things you can do. What else can cause carpal tunnel? Any one of those 8 tendons that's in there can swell a tendonitis, also pinching the nerve. So you can treat a tendonitis and take care of the carpal tunnel.
Now, with carpal tunnel, how come we started hearing more about this with the use of computers? Is there a tie-in?
Well, yeah, you're using your hands where you never used to. Many people are using keyboards that never had to. Back in the day, you had a secretary. The secretary did the typing for you. Back in the day, somebody else was out there hammering on data entry. We walked around with IBM cards. Okay, you ran them through a machine. There's nobody out there with, knocking down a keyboard. But now we teach our 4-year-olds how to keyboard. We used to call it typing. Okay, anybody actually see a typewriter anymore? No, you go to the flea market, you can pick them up for $5. But you're sitting down at the keyboard, your hand is dorsiflexed ever so slightly, okay, and you're using your fingers. You're resting directly on the forearm, which is something else that can cause hand pain and mimic carpal tunnel, and that's entrapment or irritation of the ulnar nerve at the elbow. It's called the humeral-ulnar arcade, and it will cause pain in the palm of the hand, 4th and 5th fingers, and it will mimic carpal tunnel syndrome. Very, very interesting problem. Your hands are hurting. Gee, let's find a reason to operate on you. It's about the last thing that you really necessarily want to do. But the take-home message here for carpal tunnel, and probably the single most important thing, is that when you have it bilaterally, the likelihood of it being a surgical situation is very, very small. Because what can cause bilateral carpal tunnel syndrome other than hypothyroidism? I'm still waiting to find out.
Oh, boy.
Okay? Bilateral carpal tunnel syndrome is hypothyroidism until proven otherwise. And there are many ways to have hypothyroidism that don't involve having a very high TSH. You can have autoimmune thyroid disease, you can have functional hypothyroidism, then you can have something called hypothyroidism of pregnancy. It doesn't happen often in men, although with Mr. Jenner it may eventually. You never know. Okay, so what else are we looking at? There's a small nerve there called the median palmar branch that doesn't go through the carpal tunnel. It's one of those things that gets forgotten. So when you're out there tapping on the wrist, saying, oh, this is positive Tenosynovitis sign, therefore you have carpal tunnel, if you're not careful and you're not rapping on that median palmar branch, you're picking the wrong thing, which doesn't benefit one bit from having the carpal tunnel released. So there are people out there that are making a very, very good living doing carpal tunnel releases, either the old-fashioned way, which is with a scalpel, or endoscopically. Wow. It doesn't make any difference. The failure rate for a carpal tunnel may be as high as 30% because many of them don't need to be done at all anyway.
Wow.
So hand pain, go figure. So we've got arthritis, we've got nerve, but now we also have ligament. Okay, what can you do to your hands to cause ligament issues? There's something called Gamekeepers Thumb. Well, I actually had this. I did a little number on some ice while I was trying to ski. Caught an edge, as they would call it. It came down on my thumb and suffered with this thing for 2 years.
Ooh.
Ligaments don't heal. So Gamekeepers Thumb, that these are ligament injuries of the thumb. You can see them in the fingers as well. What about fracture? Let's figure this one out. People break their fingers all the time. When and why should you go seek medical attention if you broke a finger? If it involves a joint. Okay, this is important, okay, because you can develop arthritis years down the line if you have a fracture-involved joint. So that's pretty much what I needed to say about this. Hand pain is very, very common. The way that you treat much of this stuff is topically, believe it or not. You can use oral anti-inflammatories along with it, but the long and short of it is the last thing anybody really wants to do is to have somebody operate on a hand unnecessarily.
Oh, boy. And how about that Kinkies?
Oh, wonderful stuff. Okay, Kinkies is an Msm Lotion. I developed this stuff for my daughter's horse. Okay, and it goes through horsehide. You can't really convince a horse. They don't even know what you're doing when you're rubbing stuff on their joints and so on and so forth. But when you can notice a racehorse go faster, and we use it at the track, when you notice a show horse, their gait becomes improved as a result of taking care of a joint issue, you stand back and take notice. But when you put this stuff on your hands, it goes right through the joints, right through the skin into the joints, and you end up with flexibility like you haven't seen before. This stuff is dirt cheap. It's about $30 a tube.
All right. Robin, can you put us in touch with the Stages of Life?
Yes, you can check us out on the web at stagesoflife.net. You can also give our office a call at 407-679-3337. And you can come visit us. We are located in Longwood at 1917 Booth Circle. That's right off of I-4 and 434. And our office hours are Monday through Thursday from 8 to 5. The health store is open during office hours. And you can also find us on Facebook at Stages of Life Medical Institute.
And here's more good news. You know, Dr. David Klein is with us now 5 full days a week. 5 full days a week.